I hope all are fine. Be safe, please. Today I am going to deal with dengue fever. On the previous classes, we discussed regarding arthropodal infections. Dengue fever is also one type of arthropodal infection. Dengue fever is a mosquito-borne infection which affected mainly on tropical and subtropical regions. Dengue fever having one nickname, that is break-borne fever. Why the dengue fever call it as a break-borne fever, I will see it on later. Dengue fever having one nickname, that is break-borne fever. We all have the nicknames, like the dengue fever also have the nickname, that is break-borne fever. Dengue fever is spread through female Aedes aegypti mosquitoes. Female Aedes aegypti mosquitoes. Don't forget, female Aedes aegypti mosquitoes. Then, coming to the epidemiological triad of this dengue fever, first one is agent factor, in that flavivirus is the causative agent for this dengue fever. Flavivirus, which belongs to the Flaviviridae family, which is a one type of RNA virus. Then coming to the host, age. Mainly it affected to the children's, but it may affected all the age group. Then race, it will mainly affected to the whitish when comparing with the blackish. Then moving on, there is higher chances to get like as a secondary infection. There is higher chances to get like as a secondary infection, or risk is there to get like as a secondary infections. Then coming to the environmental factor, tropical and subtropical regions. Then coming to the transmission, the infected, the wild female Aedes aegypti mosquitoes, first this mosquito will bite to the dengue infected person. Dengue infected person. Then the mosquito will go on by to the incubation. Before that, the incubation will occur within 8 to 10 days. Dengue virus incubation will occur 8 to 10 days. Then this mosquito will go on bite to the second person. The mosquito will go on bite to the second person. Then this person will get the disease or virus within 4 to 14 days later. 4 to 14 days later. Then coming to the signs and symptoms. Before that, you have to understand that first this case has been occurred on 1816. 1816, but the alarming cases has occurred 1962 2005. 1962 2005. Then coming to the clinical manifestations, the flu-like fever will occur for the children's, adult, old age and all, seldomly causes death. Flu-like fever will occur for children's, adult, adolescents, the old age and all, seldomly causes death. Then coming to the clinical manifestations, first we have to divide the dengue fever into 4. Which all are they in the sense? Dengue classic fever, dengue undifferentiated fever, dengue hemorrhagic fever and dengue shock syndromes. Dengue classic fever, dengue undifferentiated fever, dengue hemorrhagic fever, then dengue shock syndromes. Then dengue hemorrhagic fever, mainly the hemorrhage will occur. Skin hemorrhage, hematuria, hematemesis, melena, bleeding, GI bleeding, all the hemorrhagic problems will occur inside the body, or externally. That is nothing but dengue hemorrhagic fever. For the dengue undifferentiated fever, the person will occur or person will get the complaints like nausea, vomiting, rashes, mainly arthralgia and myalgia. Arthralgia and myalgia. Arthralgia in the sense pain will occur to the bones or joints. Myalgia in the sense pain will occur to the muscles. When the pain will occur to the muscles or bones or joints, that's what we will call it as this dengue fever is also call it as break-borne fever. Break-borne fever. Then coming to the diagnostic evaluations, we can do it like physical examination, serologic examination, serum examination, blood culture. Then these all we can do it. For the x-rays also we can do for the dengue fever, but mainly tourniquet test. Now I will say what is tourniquet test. Tourniquet test in the sense, first we have to inflate the BP cuff to the midpoint in between the systolic pressure and to the diastolic pressure. We have to inflate the BP cuff in between the midpoint in between the systolic and diastolic pressure, and if the petechiae will occur more than 10, then it is a positive sign for a dengue fever. When we are inflating the cuff, the inflating of cuff in the midpoint between the systolic pressure and diastolic pressure we have to do. Systolic pressure and diastolic pressure means you people know already. Then we have to do it for 5 minutes. We have to do it for 5 minutes. If the petechiae will occur more than 10, that is a positive sign for a dengue fever. I hope you people understood. Then prevention, complications, treatment and all, I will take it on later. Thank you all. If you like my channel, or if you understood the topic and if you like my channel, please click the like button and subscribe it and share it. Thank you all. Once again, thank you all. Be safe. Please be safe. It is a critical period. Please be safe. Be safe. Thank you all.